First of all, it's illegal. I mean, none of this makes sense. I think it's a terrible idea, just putting that out there. You can't do this stuff at home. Okay, but I feel like my heart's like beating faster and getting nervous. Do you think your insurance is gonna pay? Hey guys, Dr. Gary Linkov here of City Facial Plastics in New York City. I'm a facial plastic surgeon, and I have this YouTube channel that I'd love for you to subscribe to. Please make sure to like the video and also to comment below. So today I'm going to do a reaction video to people who are doing fillers at home. So there's this culture of do-it-yourself filler, and I heard about this through some friends, and I just really couldn't believe it, because in the kind of professional world we know the real risks of doing filler, and we're going to go through some of them here. But I really wanted to just watch a video of someone doing it at home, and just to check out, like, well, I'd love to know where they got the product, how they're injecting themselves, do they have any of the safety mechanisms in place if there's a complication. So let's take a look. So this is How I Did Cheek Filler at Home by Wannabe Beauty Guru.
Okay guys, welcome back to my channel. So today's a good day. Why? Because we are going to be doing cheek filler. That's right. I picked up this big bad boy, which is Replenogen Riff Deep with Lidocaine.
Replenogen. I have no idea what filler that is. There are certain approved fillers internationally, like in Europe, that aren't FDA approved here, and I don't know, I guess, where she's even filming from, but it does say Hollywood. If she's in the United States, which it seems like she is, this is not an FDA approved product. This is not like a Juvederm or Restylane. I don't know this product, and I see that she's got the markings on her cheeks already. Again, I'm not really sure, maybe she read a manual on how to do that, but she's very excited that she has this product, and let's see what she does with it.
Lidocaine is important because this is what's going to keep you numb. I've also topically numbed, but I am expecting this to still sting a little bit. It is a deeper, it's a bigger needle. It's a 27 gauge. I like to use 30 or 31 for all of my normal shots because I hate needles.
Alright, so where do we start? Well, it's good that she knows what lidocaine is. It's a numbing agent, and there is a topical formulation, usually of not just lidocaine, but a combination of betacaine, tetracaine, and lidocaine that many people will use to kind of start the numbing process. I also use that in my office. And then there is lidocaine in most of the fillers that are out there, so that when you start to inject, the area underneath the skin where you're putting the filler will start to get numb. So, you know, I'm glad she's aware of that. That's an important point. Now, on the topic of needles, she said that she has this 27 gauge, that it's kind of big, and then, you know, she likes to use 30 and 31 gauge. From a safety perspective, and from just an ease of pushing the filler through the syringe, it's actually safer and better to use larger gauge needles, which might sound a bit counterintuitive, like, wouldn't it be better to just put it through a little tiny needle? Well, not really. One of the biggest problems with filler, one of the biggest complications, is called vascular occlusion. And that's when you put it into the face and you mistakenly get it into a sizable blood vessel, and that blocks up the blood flow in the vessel, and that can actually destroy some of the skin of your face, and it can have even worse complications such as stroke and blindness. Very rare, but it can happen. If you have a 31 gauge needle, for example, and you have a blood vessel, you're much more likely to get inside the blood vessel to cannulate it, and then when you have to push this material really fast or with some force potentially, then you can block up the blood vessel and create those problems that I talked about. If you have a larger sized needle, the chance is lower that you'll get it inside the blood vessel to cause those types of problems, because the actual size of the cannula or the needle that's being used is bigger than some of the smaller blood vessels of the face. So it's an important concept when it comes to safety. So even though the 30 or 31 gauge is great for like Botox, that's what I use for Botox, it's actually not the safest way to go for filler, especially filler that is used for like the cheeks, because you need it to be a thicker or higher G' or higher viscosity filler, we call it. These are the reasons why you shouldn't be doing this at home, because most people, even most doctors, I would say, most people injecting this stuff don't quite understand the complexity of all of this. And, you know, myself, when I go to all the conferences that I go to, I lecture on this, I listen to other lectures about this, and so it's really important to understand things from a safety perspective, not just about looking more beautiful, but how do we do it and keep things safe.
Now, I have done this placement. I'm going to insert a photo here. how do you do these markings? You're basically trying to mark off the no-go zones. You don't want to go too close to the nose. You don't want to go too low. You want to inject onto the cheekbone.
So you've got this photo here. I'm just going to kind of break it down. The X is showing you where not to inject. I guess she's looking to inject her cheeks, right? So this is the map that she has for herself for her cheeks. A lot of things to say about this, but let's start with the patient's right side, which is the left side of the screen. There's an arrow pointing to the angular artery. The truth is that's way too lateral to where the angular artery is. The angular artery lives closer to the side of the nose, and the place where you're most likely to get it is actually right here in this groove. Right here in that groove, which is the alar facial sulcus, is where you're most likely to get it with a certain injection, and then it rides up the side of the nose. So that's the angular artery. It doesn't live like all the way out here like this arrow is pointing. And then the other side, the other blue arrow, which is to the facial artery, the nerve and the glands, it's sort of like in no man's land. I mean, first of all, what glands? I mean, are we talking about the parotid gland, the submandibular gland? Those live in different locations than where that arrow is pointing. The facial artery also doesn't live up here. It has branches that kind of go all over, but the main facial artery is actually further down here in terms of where on the face you can inject to get it. I mean, obviously it starts deeper in the upper neck, but then the facial artery is going to be here. You can feel for it. If you feel along the jawline, there's a little groove here called the facial notch right here, and the facial artery runs right along that, and then it starts to kind of curve in towards the center of your face. This picture is not really doing it justice, and then the location of where the filler should go is more or less okay, but what I like to say is you should target the bone here, the zygomatic arch, which should be one of the main focal points, and not so much in the medial cheek, which is where C is, because it's a bit artificial of an appearance when you have a lot of filler just sitting in here. You kind of want to keep it lateral to create that heart-shaped face and lateralize the upper face. So again, I'm just giving you guys pointers on what I use to determine how to inject patients in the office. This is not meant to give you clues on how to do it at home. I don't think that anyone should be doing fillers at home. I think it's a terrible idea. Just putting that out there.
Really trying to mark off the no-go zones. You don't want to go too close to the nose. You don't want to go too low. You want to inject onto the cheekbone. And it's on the bone. It's an on-the-bone injection. So you're going to literally pierce the skin to the bone.
For the most part, I do agree that cheek injections are meant to be done on the bone. However, when you're treating the medial cheek, which is a little bit more in this region, I come off the bone, because if you treat on the bone, it's going to take a whole lot of filler to create any sort of cosmetic change. So on the bone, my opinion, on the lateral cheek, and off the bone as you get into the medial cheek.
Feel it and then inject. So for me, I am thinking that I want to do 2.2 on the first 2 points and then 1 on the last, and that's going to give me a total of 10 units, right? So 0.2, 0.2, 1, that's 5, and the whole syringe is 10.
So for most patients, I do recommend 1 syringe divided between both sides. So in that sense, I wouldn't draw it out the way that she has it drawn out, because again, most of the filler is going to concentrate too far into the center of the face. As we age, everything comes in from the lateral aspect into the center of the face, from the sides into the center and down. So you want to try to bring the eye away from that and bring it out. So that's the way you have to think about the face 3-dimensionally. So I wouldn't inject into those points, but in terms of generally breaking up a syringe of filler into 0.5, 0.5, I think does make sense. Some of my patients benefit most from 1 syringe on one side and another syringe on the other side, but for most patients, 1 syringe total for the lateral cheeks does make sense.
So like 10 measurements of 0.1. So this is my syringe. I have been warming it up in my actual wet cloth that I have microwaved, and that just helps the filler become more liquid.
There's nowhere that it says you have to warm up or microwave or keep the filler warm. You just use it out of the box. It's just kept at room temperature. So That's false.
It does come with a cannula, which I'm not going to be using, and then your actual needle. How does this work? Really simple.
Just to highlight the difference between a cannula and a needle. So a needle has the filler come out of the end of it, and it's obviously sharp. A cannula is blunt at the end, and the filler comes out of a side port. So the cannula is in general a safer way to do it, but when you're doing injections onto bone, a needle can be helpful.
Obviously, keep everything sterile.
So she's talking about keeping everything sterile, which it's sterile, but you know, you can't keep it sterile if you're not wearing gloves. You know, I'm not really sure what she's talking about here, but at least, you know, an attempt would be to try to put gloves on. That brings me to another point. Filler is thought of as an implant. Okay? And if you're putting an implant into the face, you need to make sure that the skin is as clean as it can possibly be, and also you're wearing gloves. You actually don't need sterile gloves. No one really injects with sterile gloves, but you need clean gloves that have never been used before for these injections. The other thing that I do in my practice is use chlorhexidine wipes, and those really clean the skin, you know, super well, better than alcohol wipes. And I do that after I've rubbed off the numbing medicine and before I actually go to inject, because if you have some dirt on your skin, you're putting a needle through it, it can track all that directly through, and then you get an infection. And because you just put an implant in your face, you know, you have a problem, and you can develop nodules, infection, cellulitis, biofilms, bad things.
Twist off that end if I can get it off. Ugh. Okay, sometimes this is harder than it should be. Okay, I'm trying to twist off the needle part. Damn it. Houston, we have a problem. So that is not coming off.
She just got frustrated and recapped the open syringe that she said she was trying to keep sterile. I mean, none of this makes sense. You know, it's just bad. I mean, it's bad because she could have a real problem after this type of injection, develop infection, and then she's gonna have to see someone like me, or, you know, go to the emergency room.
Okay, there we go. I think so. Yes. Thank goodness. That took way too long. Now, to put this in. Now, I'm going to not be going directly into the parts that you see. What I'm going to be doing is going in right in front of them. And I think we're just going to jump into it. You can see this is what the syringe looks like. The trickiest thing in my experience is trying to make sure that you can see the amount that you're putting in as you do it.
The way to get around that is to actually just peel off the little label. That is how I do it. It's not hard, it's pretty basic, and it helps you keep track of how much you've injected. So
it looks like I have a little bit more than I need, so I'm going to go hold on, so 2.
She's having trouble counting before she even puts it into her face. Now imagine keeping track of how much you injected while the needle is in your face and you're bleeding.
2, 1, then 2, 2, 1. Okay, that's fair. So I'm just making sure that I see everything. Cool. Okay. So yeah, let's just jump into it because we can.
Like, honestly, I feel like my heart's like beating faster. I'm getting nervous for her. Like, I know this was in August of 2020, so God knows how she's doing now, but it's just such a bad idea to do this. And there's so much room for error. It's bad enough that you can go to a practitioner or provider, whether it's a doctor or not, and have a problem. Even in the best of hands, real issues can come about. But when you're doing this at home, like with something that's not FDA approved, you're just asking for so much trouble. And then imagine if you have a complication, you go to the ER, and then, you know, they write it all over the chart, and then like they send that over to your insurance company. Do you think your insurance is going to pay for all of the complications, if there are any? I don't know. It'll be a hard sell to the insurance companies.
This is going to happen.
Plus, I'm pretty sure this is illegal. You can't do this stuff at home.
I'm going to try and hold my skin taut. It is a direct injection. I'm going to aspirate for 12 seconds. Okay.
An aspiration is when you pull back on the needle before you inject the filler to see if you get a flash of blood. It's been researched actually extensively now, and the latest consensus is it really doesn't help to aspirate. Yes, if you were to pull back on a blood vessel, that is a good clue if you get some red blood that, hey, you shouldn't inject there, right? The problem is, forget about if you're doing this on yourself, but if you're just doing it, if I'm performing this on a patient and I go to aspirate, right? Whether it was for 3 seconds, 5 seconds, 8 seconds, doesn't matter. The moment I'm ready to inject, I've kind of created a little bit of a micro movement. It's impossible to stay perfectly still. And then the second I move, I'm already putting filler into a slightly different location. If you get a negative flashback, meaning you aspirate, there's no blood, if you go to inject, it could be a false sense of security because you can be injecting still into a blood vessel. The best way to prevent what's called the vascular occlusion, which is the whole reason to aspirate, is to just know your anatomy. And so that goes back to the original picture that was flashed on the screen, and I was just pointing out that certain things are just wrong, and that's probably, I don't know who made that, that picture, and well, I don't think it was her. It was probably some sort of online resource, but you have to really go to someone who knows their anatomy and knows where all these blood vessels live to at least avoid the bigger ones. You can't avoid every little blood vessel, but you can avoid the big ones that have names that can really give you a lot of problems. I don't aspirate in my practice for that reason, and most of the experienced injectors don't either. There are still some who do, and it's not that it's wrong, but you don't want to be lured into a false sense of security.
I'm gonna hold my skin taut, make sure that I'm facing the camera.
Now, sometimes when you have a needle go into your face, you can get a little lightheaded, feel kind of faint. And what if she were to pass out with a needle in her face? Think about the dangers of that. Forget about vascular problems from the filler injections that could come about, but also injuring your head, having really, a bad fall, something like that. It's very possible to kind of get a little lightheaded from these injections, especially when you're sort of sitting up, and there's also, she's not resting her head on anything. And the other thing is, does she have the material to dissolve these fillers? Most of the fillers that are being injected these days are hyaluronic acid-based fillers, and they come with an antidote. You have to buy it. It's called hyaluronidase, and that's kept refrigerated, and it kind of eats away at the filler material. So if you do get into a blood vessel and you start to notice that the skin's kind of feeling cold, it's clammy, it's starting to change color, you have a lot of pain, you have to inject this thing called hyaluronidase to break down that filler. Odds are she doesn't have that at home. There are many providers that don't even have that in their office. So when you're going to get that filler in the face, make sure that your provider at least has hyaluronidase stored in the fridge, and that you're not just going to be sent to the emergency room where you don't even know if they're going to have it there if you were to have a complication. So always be thinking not about just saving money and getting a quick result, but how do you prevent complications? But if you were to get one, what do you do about it?
Okay, that didn't hurt, but I'm gonna take it out because I didn't feel the bone. And I had the whole needle in and I didn't feel the bone. So that's scary.
I don't know if she's washed her hands, but she's got her hands all up in there, no gloves. She puts the needle in, but she doesn't feel the bone. I mean, the bone is there, but again, the issue here is that she's too far medial, meaning too far to the center of the face. So in that location, I don't inject on bone, I inject more superficially to be able to see the impact of your injection. So the reality is, if you look at the marker that she's kind of marked out the side, so I'm injecting here for the majority of my patients. She's injecting right here. That's part of the problem here. Of course there's bone, but even if she reached the bone and put filler in, it's not going to create a dramatic impact, especially with 0.2 cc's, and even if it does create a dramatic impact, it's not a natural look because you don't want to make this any heavier. As we age, like I said before, this comes down and this gets thicker, and that's why you get these folds, that's why you get these folds, that's why you get the jowls, and that's why the neck hangs. So you don't want to be making that part worse.
What the hell? Why did I not feel the bone? I don't like that. Hold on.
I love how she keeps going with the video. That's dedication.
Now that we've made a bloody mess, let's do it again. God damn it. And of course now my cat's trying to jump up, changing my sterile environment. God damn it. Okay. You know what? I have an idea. No, I don't want to do that either. Gosh darn it. Okay, let's try this side. Because this side, I feel the bone. We're feeling good about it. Other side, attempt number 2. But I didn't feel the needle. It wasn't painful. You could feel it going in, but it wasn't painful. Okay, we're going to try this over. Hold on. Arg. Damn it. Okay. Now I'm going to aspirate. But holy crap, you really bury that needle in there. Okay, 1, 2, 3.
So as she's aspirating, to my point from before, notice how much movement there is. She's trying to stabilize it with the other hand, but there's still so much movement, and that's the reason why aspiration generally does not work.
Finish the aspiration. Now I'm going to reposition this because I'm going to have a hard time seeing. So what did we decide?
From this angle at 7:03, it literally looks like this needle's like in her eyeball, which is frightening.
We said that we were going to use 2 mils.
I'm gonna fast forward this a little.
So warning, you might bleed a little bit. I'm bleeding. It's fine.
So if you're bleeding during the procedure, you're at a higher likelihood of getting bruising, which nobody wants. So what I do is when I see some bleeding, I really take time, I hold pressure, I make sure that it stops before just moving to another area. Not every provider does that. I mean, I've definitely seen people who just let people just bleed around their whole face and they're like, oh, we're done. And then they clean up the mess, but that kind of leads to a higher risk of bruising afterwards. So it's best if you can stop the bleeding, or if your provider rather can stop the bleeding as they're going and not just fly through the whole procedure. And don't be impressed by someone who's just trying to inject faster. Faster is not safer, faster is less safe.
Now I'm going to go on the next point. Okay, now hold it up. Damn it, now I have to turn the damn thing.
I hope the cat doesn't touch her elbow. Oh, she could slip.
You want on the bone, so you're not injecting while you pull out. You are inserting the needle, injecting, pulling out.
Alright, I think I've had enough of this video. I'll just leave off on, I understand why people want to do this themselves. I get it, you know, it's costly, like you go to the doctors, you have to keep getting the stuff repeated, and it adds up, you know, not everyone's in a great financial situation, and it can be expensive, but people want to look better, they want to look, you know, how they envision it. So I get, you know, the financial side of it, and I get just feeling like, well, hey, like if this person can do it, I can do it too. But I just have to caution everyone out there to really not just think twice, think 10 times before venturing out on this type of journey. There's so many reasons why it's wrong. First of all, it's illegal. I mean, if you don't have the right license, even if you do, you're not allowed to be doing it on yourself. I mean, I can't inject myself with filler. That's ridiculous. Problem number 2 is the products that you buy, the FDA approved product, the companies that are respectable companies that actually manufacture the stuff that we use here on our patients safely, they'll never sell to someone who doesn't have the right license. And so she couldn't buy it from them, and so then you're buying from like the black market online, and God knows what they're putting in the syringe. Just like if you buy drugs from, you know, unauthorized places or anything else, you don't know what they're putting inside, what kind of chemicals, what kind of other substances, and now you're injecting this yourself into your face. Like, think about that, you know, not very smart. Thirdly, if you have a complication from an injectable, where are you going to go? You don't have the right tools at home to deal with it. If you run to an ER, you don't know if they do, because not every ER is familiar with these types of injectables. And then, you know, your insurance probably won't cover any of the costs of this kind of mess up. And then, most importantly, I mean, this is your face. Yeah, you can really cause lots of problems, permanent problems, that aren't really reversible. So yes, fillers are temporary. Some of the problems that you cause from fillers are not temporary, such as like the blindness, the stroke, the loss of skin to the face, kind of deforming different parts of your face, not looking natural. All those things are just going to kind of stay with you. So yeah, I really just would strongly advise against this type of practice, and just seek out someone who does a lot of injectables, who teaches how to do these types of injectables to other providers, who really understands the anatomy, who understands the different types of fillers that exist, and also understands like your vision and what you want in terms of improving the way you look. All that is very possible to achieve, and you can find someone who will do it at a fair price or something you can afford. Don't put yourself through this. Alright, so I welcome Beauty Guru. Come to my practice. I'd be happy to safely inject her, or anyone else who wants to check out what I do. But again, safety is always #1 paramount thing. So hope you guys enjoyed that. I'll be doing more of these reaction videos. So remember, please like the video, comment if you have any feedback at all, and subscribe to the channel. Thank you so much.